The vomer bone, positioned in the posteroinferior part of the nasal septum, is a single flat plate with two surfaces and four borders. It forms through the fusion of two plates, separated at the top to create alae that articulate with the sphenoid bone. Ossification of the vomer occurs in membrane during development. This bone articulates with several neighboring structures, including the sphenoid bone using a tongue and groove mechanism, as well as with the palatine, maxillary, ethmoid, and septal cartilage. These articulations are crucial for the stability and structure of the nasal septum within the nasal cavity, ensuring proper function and support. The vomer's role highlights the intricate anatomy that contributes to the overall function of the respiratory system and nasal passages. Vomer bone location. Posteroinferior portion of the nasal septum. Vomer bone has a plate with two surfaces and four borders. Two plates fused into one flat bone but separated at the superior border to form the alae, enclosing a deep groove for the articulation with the sphenoid. Physiological motion. In flexion, synchronous with sphenobasilar flexion, the vomer is moved with the sphenoid, as well as the maxilla, etc., so that the superior border goes posteroinferiorly with the rostrum and the inferior border follows the nasal crests in the same direction. Meanwhile, the anterior end elevates slightly. The opposite occurs in extension. Lesion mechanics. The vomer is not usually involved in a bent septum. It is usually lesions secondarily to the position of the sphenoid, although trauma to the facial area can be a factor. Lesion diagnosis. Asymmetry of the face, a torus palatinus or warping of the hard palate is suggestive. To test for motion, place the pad of the index finger on the cruciate suture inside the mouth to sense the movement transmitted through the bone from above. Control the sphenoid with the other hand. Tip the sphenoid on its transverse axis into flexion and extension. Maintain the position into which it goes most easily. Then use the antero-posterior axis for elevation of the greater wing on one side or the other. Again, note the greatest amount of freedom. The combination indicates the lesion position of the vomer. Lesion correction. Maintain the balance on both axes of the sphenoid. Exaggerated flexion or extension of the sphenobasilar by way of the vomer is a useful technique in many congestive conditions. This may be done with the patient seated or lying down. To exaggerate an extension lesion, insert the pad of the index finger upon the cruciate suture to serve as a fulcrum. Have the patient tip the head down against it. The pressure transmitted up the posterior part of the vomer to the rostrum will rotate the sphenoid into extension because of the elevation of the vomerosphenoid articulation. Moving the fulcrum finger to the anterior end of the intermaxillary suture produces just the reverse position.